that's been moving quickly in the last few years. It's been now 15 years since the approval of Herceptin, trastuzumab, which has really changed the natural history of HER2-positive breast cancer. HER2-positive breast cancer used to be the worst prognosis breast cancer one could have. And we started to learn that around the time that the therapy was developed. And today, it actually is one of the more favorable types of cancers to have. So in early stage cancer, the chance of recurring is lower if you get HER2 targeted therapy. However, with advanced breast cancer of any type, we're not able to cure it. We can sustain remissions, we can induce remissions, but ultimately patients become resistant. So the area that has advanced the most in the last couple of years has been how can we circumvent that resistance, or how can we make the initial therapies more powerful? How can we rescue patients that progress on HER2 targeted therapies? So from the laboratory, we had some clues that the HER2 signaling pathway has variations in it from cancer cell to cancer cell that can make the signaling pathway impeded such that HER2 blockade no longer works. Sometimes that happens at the very beginning. Patients are resistant to trastuzumab from the get-go. Other times they will develop it over time. One of the first drugs to be studied, actually around the same time that trastuzumab itself was studied, is another antibody called pertuzumab, also known as Perjeta. And it doesn't really work that well by itself, but when it's combined with trastuzumab, it actually binds to a different part of the HER2 receptor. It's an antibody just like trastuzumab is, but it prevents the binding of other receptors which are necessary to activate HER2. So HER2 can bind to either HER1, which is also known as the epidermal growth factor receptor. It can bind to HER3 and HER4. Pertuzumab inhibits that interaction, so it works in a slightly different way. When you combine those two antibodies, you do get a synergistic effect. And we were all surprised to see how big that effect was. In the trial that combined pertuzumab and trastuzumab along with chemotherapy, the number of recurrences that occurred over time was reduced. So the progression-free survival was increased by over a third. So that's a substantial improvement, and survival is improved as well. However, people ultimately become resistant as well.